So that question about what is the incentive for someone to use a system that we're marketing instead of just building their own physics screen, that's actually an excellent lead-in to my presentation, which is incentivizing waste management in under-resourced areas. And what I mean when I say under-resourced areas is sort of these vast urban slums with desperately poor people, or rural areas where there's no utilities of any kind to speak of, very low access to sort of marketplaces. So just keep that in mind as I go through my presentation. And by the way, I'm an undergrad at Duke University, so also keep that in mind. Try and go easy on me during the questions. So when looking at when we're marketing these interventions or these products to the people that don't have sanitation, what are they looking for? What do they actually want from us? And when we look at how international development has played out already, we can see that there are more people who have cell phones than have toilets. Or we can look at that there are more people who have access to electricity than have access to running water, or who have access to a latrine. And you might ask yourself, is it because they want it more? Is it because it's easier to give it? And I can tell you right now, it's not because it's easier to give them electricity. I worked on an electrification project last summer, and it was not a cakewalk. So I think the reason why is because there's there's a higher demand for it. And so when you're looking at what the community actually reports that they want, and what the community actually reports that they need, will vary a lot based on the community. A migratory animal-based herding community will have a lot, they'll say that they need very different things than like a peri-urban agricultural community. So it's very dangerous when you start saying, the third world needs this, or Africa needs this, because then you'll end up just shooting yourself in the foot when you get on the ground and smack in the face with reality. But generally speaking, and I'm saying this very cautiously, people care a lot more about employment opportunities, improvements to their infrastructure, and improvements to education and healthcare than they do about sanitation. Now, as you move into more densely populated areas, when they actually have to deal with, on a day-to-day basis, stepping in, the feces and the urine, then they're going to start caring more about sanitation. But even when you get into those areas, it's only going to be sort of the middle class of the slums that can afford to pay for these pay-per-use facilities. And then when we're looking at, who's giving these microloans? Who's subsidizing these costs? Who's donating to these charities? And what are their priorities? And we can see from this chart that their priorities are not in water and sanitation. They're in healthcare. They're in education. And so when we consider all these things put together, along with our interests, which I'm assuming because you're in this room are sanitation and reducing diarrheal deaths and all that kind of stuff, we have this big gap of wanting to bring people and their concerns on the ground where, how do I increase my crop yield? Or how do I make sure that my animals are healthy? Or how do I help, the global people who are underprivileged and all that kind of stuff? And how do we keep people from dying from diseases that they really just shouldn't be dying from? And I think that I might have come up with something that could help the situation. So this is just one application of a model that I'm going to talk today about, which is kind of specific to the area that I'm working in. But what it does is, instead of looking at sanitation as a problem, it starts looking at it as a resource and starts leveraging the resources that we get from sanitation to provide something that communities actually value. So the community that I'm working in, they have hugely inflated electricity prices because they have no access to the grid. So you guys, we pay about 9 cents per kilowatt hour for electricity. And that's some of the cheapest electricity prices in the world. In the community that I'm working in, they pay about $15 for a kilowatt hour of electricity. So because of that, we can sell electricity to them and make a profit off of that. And the way that we're generating that electricity is through the anaerobic digestion of the human feces to generate methane, and then we put that into a special generator, combust that, create electricity, and sell it to them through a cell phone charging business. And that creates enough revenue to hire 3 run this entire system, also provide soap and running water and tissue paper, and so the electricity business, we have profit models already demonstrating that we can run the entire system off of that, because honestly that's the only price that I know, because that's the only thing that I'm selling to them right now, because that's the project that I worked on last summer. But the system will also create employment, so we will employ 3 people above what the normal wage in the area is. And then we'll also be creating, in addition to all this, it is a profitable business that will be run by people in the area. And so after the anaerobic digestion that will create the methane, there's still leftover nitrogen from the urine that'll be going through another that'll be going through another biological process that'll create nitrate, which will feed into fertilizer and fish farm. The profit will be going into a community-managed fund that will feed into education, infrastructure, and healthcare initiatives.
All right, I do want to make sure we have enough time to answer people's questions, so open it up.
Yes.
This is really interesting. So with the cell phone charging, it seems there's a lot of applications of the methane and energy. So and you talked earlier in the presentation about community needs. And so this is sort of, what about communities that need gas for cooking, or need the energy for other applications? So I'm just wondering if you took a step backwards and sort of looked at the methane as the linchpin and not necessarily direct applications of electricity for charging cell phones. Have you considered that at all?
Well, that's exactly what I'm talking about. So that's really good that you're thinking about it like that. And so I haven't thought about it because the only community that I'm working with right now is this one. But if I were to go in a community that wasn't needing electricity, but did, was looking for a new cooking fuel, then yes, I would look into that. Yeah.
Do you treat the biogas at all before you put it through the generator? Purify it, or you just combust the biogas?
We just combust the biogas. We have a specialized generator that is able to just work on that. Yes.
Do you have any issues with maintenance and repair of the facility?
So the actual, the only thing we should have issues with maintenance is the generator. Everything else pretty much just runs off of gravity. We're renovating, I didn't get to talk about this, but we're renovating an old sanitation facility that was built by a French charity back in the 1980s. So the latrines are actually in a 2-story building, and everything just sort of flows downhill from there. So there's no pumps, there's nothing like that to worry about.
Has there been any cultural issues with handling human feces?
Yes, there definitely has been. And what's really great about this project is that it was actually, I was not the impetus to starting it. There's a man who lives in the village, he grew up there, he has a family there, and he's the one who asked me to help him on it. And so he's been running full-time education campaigns, publicity campaigns for this project to get people to start talking about sanitation and the problems around it. And I think with sanitation initiatives, that's the only way that they can really work, is if the community itself is invested in getting them to work.
Is the facility that's being rehabilitated and retrofitted one that's already commonly used, or
No.
So you're having to work on behavior change to use the facility as well as the process itself?
The facility, it works by using a lot of electric motors and solar panels and all this kind of stuff. About a year after the operators, they were French, it was a French charity, left, the community sort of lost its interest in it and started stealing things, and it all sort of fell apart. But they do use, there are some private latrines in the area, and that's sort of seen as like a status symbol. So people do use latrines in the area, and
Just getting them to use this one?
Yeah.
Okay.
So the reason, the great thing about this system is that it will be completely free to use. Because it generates revenue independently of asking people to pay to use it, it'll be free to use, and we're actually looking into being able to give people like a coupon if they go in and use it to have a cheaper price for using electricity. The one issue with that is monitoring to see, did you actually use the toilet, or did you go in and hang out there for a second? And they might actually, they've been ripped off by charities so many times being like, I have the answer, and then a year later they're out of money, so they leave. Any other questions? Real quick, I just want to go to this slide so you can see all the great people who are helping me, one of whom is in the audience. Yes?
What's the cost per kilowatt hour?
So the total cost in terms of materials for building the system is about $4,000. That doesn't include the cost of transporting me and my team to the site. And it also doesn't include the cost of building the site that exists right now. We haven't calculated how much it costs to build that. So that's a huge unknown that we'll probably be figuring out on the site. What we also are going to be figuring out over the next year is we'll be going back in December and in March to evaluate critical diarrhea cases in the local clinic. So it doesn't really relate to your question, I just want to make sure I mention it. But the electrical generation that we're expecting is about 1.6 kilowatts.